Hey everyone, this is Jay.
And I'm Amber.
We're with Precision as S. Welcome to our deep dive today. We try to cut through the noise and get right to what matters in the sources you send us.
Yep. And today we're tackling something that seems to be on a lot of minds for adult family homeowners in Washington state. Specifically, how do you actually attract private pay clients?
Yeah, it's a big one, isn't it? Such a key piece for building a sustainable business. So our goal today is simple. Dig into the source material we reviewed and pull out the really practical stuff.
Right. We're looking at two main things, really. First, where can you actually find these potential private pay clients?
And second, what services do the sources suggest they're really looking for? What makes them choose one home over another?
And for this, we looked at a few different things. Some state resources about AFHs, the official stuff.
Okay.
And then we crunched some numbers, looked at income data, wealth distribution across the state.
The money map.
Kind of, yeah.
Yeah.
And also some material that discussed specific strategies for, appealing to that private pay market.
Got it. Okay, let's jump right in then. First things first, the sources seem pretty clear on this, but let's define it. What exactly is a private pay client in this AFH world?
Yeah, good place to start. So the sources basically say these are the folks, individuals or their families, who pay for care directly out of their own funds.
Not using government programs like Medicaid?
Exactly. They're using savings, investments, long-term care insurance sometimes, but it's private money.
Okay. And the sources mention that AFHs with a DSHS contract, that's the State Department of Social and Health Services, those are the ones set up for Medicaid.
Correct. So private pay operates outside that specific contract system. It's a different financial path for accessing care.
Which brings us to the why.
Yeah.
Why should an AFH owner actively try to attract these clients? What's the benefit?
Well, the sources really point to expectations. These families, because they're paying directly, often have higher expectations.
Higher expectations, how? Like
Yeah.
quality.
Quality, yes, but also personalization. The sources say they tend to be more selective. They're really vetting the homes carefully.
Makes sense. If it's your own hard-earned money on the line, you're going to look closely, right?
Absolutely. And the sources even listed specific things these families often look for. They value things like having licensed nurses involved.
Okay, clinical oversight.
Yeah. And really thorough assessments before placement. They want to be sure it's the right fit, not just any fit.
Peace of mind.
Totally. And they also want to see clear, customized care plans for the caregivers. It shows competence and supervision.
Right. It shows there's a plan. The care isn't just haphazard. So they value professionalism, customization, clinical input, and they're willing to pay for that level of service.
That seems to be the core message from the sources, yes.
Okay, this leads us right into the next big piece. The where. Based on those income data sources you mentioned, where in Washington are these families likely concentrated?
This is where the data gets really interesting. Understanding income levels gives you, like, a heat map for potential private pay clients.
So what did the statewide numbers show? Is Washington generally affluent?
Relatively speaking, yes. The data showed the average household income across the whole state is around $129,559,
Wow, okay.
which is actually like 17% higher than the U.S. average, and the median income, which is often a better indicator.
Right, the middle point.
Exactly. The median household income is about $94,952, also quite a bit higher, maybe 21% higher than the U.S. median.
Okay, hang on. You mentioned median is often better. The source material talked about average versus median. Why is that distinction important here?
It's a really good point the source made. Think of average income like this. You add up everyone's income on a street, divide by the number of houses.
Okay.
But if one super rich person lives there, their huge income pulls that average way, way up. It makes the whole street look richer than it maybe is for most people.
The billionaire effect. Skews the numbers.
Precisely. The median income is the number smack dab in the middle if you lined everyone up. It gives you a much better sense of what a typical household actually earns and might have available for something like private pay.
So median shows typical capacity, but average might show where the really high wealth is concentrated.
That's a great way to put it. The source kind of implies you can use both. Median tells you about the broader market. Average can pinpoint those pockets of extreme wealth.
Useful distinction. What about older adults specifically? Does the data say anything about their income?
It does. For households headed by someone 65 or older, the median income is lower, around $65,404 according to the source,
Okay,
which suggests that often it might be the adult children, maybe with higher incomes reflected in those overall state numbers, who are actually footing the bill for private pay.
makes sense. So with all that data, did the sources point to specific regions in Washington as prime territory?
Oh, yeah. Several areas popped up consistently. Eastside King County was definitely mentioned, places like Bellevue, Redmond. No surprise there, maybe.
All right, those areas are known for higher incomes.
Mm-hmm. Snohomish County, too,
Oh, yeah.
especially areas like Mill Creek, Bothell, Linwood. Those came up in the sources.
Okay, still generally north and east of Seattle.
Yeah. And also Shoreline, Woodinville, North King County generally. But interestingly, one source also mentions Spokane.
Oh, over on the east side of the state.
Yeah. The thinking there was its appeal to retirees and, relatively lower cost of living compared to the Puget Sound area. Maybe private pay is more accessible to a slightly broader group there.
That's smart. Looking beyond just the absolute highest income spots.
It is. And the sources get even more specific. They actually listed some zip codes with crazy high average income.
Oh, okay. Now we're really drilling down. Give us a couple of examples.
Okay, so the source flag 98039, that's Medina, right? Average household income there was over $459,000.
Whoa. Okay.
And another one, 980-705 Samish area, average over $318,000. Now, again, these are averages, so they can be skewed.
But still, numbers like that clearly signal significant wealth in those areas.
Absolutely. They show concentrations where families likely have the resources for private pay options.
So the big takeaway here, based on the data, is that AFH owners can be strategic. Focus marketing, outreach, maybe even service highlights towards these higher income regions and specific zip codes.
Exactly. It's about directing your energy effectively. Knowing where to look is a huge first step.
Okay, solid advice grounded in data, so we know where to potentially find them. Let's shift to what they want. According to the source material, what services really attract these private pay families? What do they value most?
The sources keep coming back to professionalism and really high-quality services, things that build trust.
Can you give specifics? What did the sources call out?
Sure. One big thing was professional placement assessments. Not just a quick check, but a really thorough evaluation to ensure the home is genuinely the right match for the person's needs, their health, even their personality.
Families want that assurance, especially paying out of pocket. Avoid a bad fit.
Exactly. It gives them peace of mind. Another thing was detailed caregiver care plans.
Okay, what does that entail?
It means having clear written plans that outline exactly what the resident needs and how caregivers will provide that support. The sources said this reassures families that the staff are competent, guided, and supervised. It shows organization.
Right, demonstrates that the care is planned and intentional, not just reactive.
Precisely. And then a service that came up again and again as really valuable to these families: professional nursing care plan services and nurse delegation.
Ah, the RN involvement again.
Yes, having that licensed nursing oversight signals a higher level of medical competence and regulated support. For families investing significant personal funds, that clinical piece is often crucial. They're buying quality care, and nursing involvement is a very clear indicator of that.
I can definitely see that. It's a differentiator, right? Shows you're equipped for potentially more complex needs and have expert oversight.
It really seems to be. So offering and, importantly, highlighting these kinds of professional nurse-driven services, the assessments, the detailed care plans, the nursing support, this is what helps an AFH stand out to those private pay families looking for quality.
Okay, so the sources give us the where from the income data
Yeah.
and the what in terms of these high-value professional services. Now, how does Precision Assess fit into this picture? Based on the source material we looked at, how does it help AFH owners actually deliver these things?
Yeah, this is where it connects practically. The sources say these professional assessments and care plans, especially with nursing input, are key attractors. But let's be real, that can be a lot for a busy AFH owner to manage consistently on their own.
Right, they're juggling so much already.
Exactly. So this is where services specifically designed to provide that expertise can bridge the gap.
So how does Precision Assess help AFHs meet those specific needs we just talked about, the ones private pay clients value?
Well, the source describing Precision Assess talked about our model. We provide those exact things, the RN-led assessments, the detailed care plans using a hybrid approach.
Hybrid meaning?
Meaning we can do it flexibly, telephonically, virtually, or even in the home, whatever works best for the situation and the AFH owner. That flexibility makes accessing professional support much easier.
Yeah, that sounds really practical for busy schedules.
It is, and crucially, tying right back to what the sources say private pay families want, our assessments are led by registered nurses.
Okay, there's that RN piece again.
Exactly. So the AFH is getting that high-level clinical expertise involved right from the start, ensuring that thorough professional evaluation that gives families confidence.
It directly addresses that desire for licensed nursing involvement.
It does. The source also mentioned our focus on quick turnaround times, which is huge when families are often making decisions quickly under stress.
Definitely important.
And it described our approach as personalized, kind of boutique, meaning it's not just a generic checklist, it's tailored to the actual resident and the specific home environment.
Okay, so basically, by partnering with a service like Precision Assess, an AFH owner gets an easy way to integrate that high-level nursing expertise for assessments and care plans.
Right.
It lets them consistently offer those key professional services that, as the sources show, attract and reassure private pay clients. It helps them position their home effectively for that market.
That's the idea. It allows the owner to focus on the day-to-day excellent care while ensuring these critical high-value assessment and planning services are handled professionally and consistently.
It provides the support needed to meet those higher expectations we talked about.
Based on what the sources tell us, yes, that seems to be the connection.
Okay, great. Let's start wrapping up this deep dive then. What are the main takeaways from slicing through these sources?
I think there are a few clear ones. First, being strategic about marketing means knowing where your potential clients are. Using that income data, looking at regional patterns, it helps you focus your efforts intelligently.
Right. Work smarter, not just harder. Find those high opportunity areas. And
Second, based on what these families are looking for, it's all about demonstrating quality and professionalism. Specifically, offering and highlighting services like really thorough assessments, customized care plans, and importantly, that nurse oversight. That's what resonates.
it's about aligning what you offer with what they prioritize and value.
Exactly. And the sources also suggest that partnerships can be key here. Using services designed to deliver these professional assessments and care plans, like we discussed, can be a really effective way for AFHs to consistently provide the quality that attracts that private pay market.
So really, attracting private pay clients isn't just luck or waiting for referrals. Based on this deep dive, it's about smart planning, positioning your home and services strategically, and having reliable support to deliver the specific kind of quality and professionalism these families are actively seeking out.
Yeah, it's a much more active, business-minded approach, informed by the data and understanding the market.
Definitely. Okay, here's a final thought for you, our listener, to chew on after this deep dive. Take a really honest look at your own AFH. Think about where you typically market or where your residents come from, and think about the services you really emphasize. Are they truly lining up with what this data shows about where potential private pay clients are clustered? And maybe more importantly, are you highlighting the specific high-value services, those assessments, those care plans, that nursing piece that the sources say these families are specifically looking for?
That alignment is such a critical question for growth, isn't it?
It really is. So if you're an adult family homeowner and you're thinking, yes, I want to grow my private pay clientele, and you see how bringing in that high-level nursing assessment and care planning could really elevate your home,
And help attract those clients you're looking for.
then we invite you to reach out to us at Precision Assess. You can learn more about how our RN-driven services are specifically designed to help support your goals in attracting and serving private pay clients.